Thank you, Dr. Schnall, for kicking us off. With that, we'll turn it over to Reed Holman, who will talk to us from his perspective as the director of the Idea Lab at DHHS. Thanks.
Hi, thank you. I really appreciate that. I unfortunately am not the director of the Idea Lab. I feel like since it's being webcast, you might be watching. I should probably.
Senior advisor.
Yeah.
Sorry, I'm not following the script exactly.
No, that's
so
fine.
thank you
That's
for
fine.
correcting me.
Thank you to the Institute of Medicine for hosting this conversation. I think it's very interesting, very timely. It's a fast-moving market, very fast-moving industry, and it looks like there is a problem with content in Holman.pptx. Oh, you want the thing again? Yeah. There's a PDF on there. Maybe that'll work instead. I guess I could just talk until.
Whatever you prefer.
Yeah. So can I react to that
Yeah.
last? It was really interesting. Part of my role at the Department of Health and Human Services is actually to bring in what we call entrepreneurial methodologies, sort of startup principles, the types of things that are often incorporated with. Let's see if this is going to work. The things that are often incorporated with Silicon Valley, sort of like the world of. Oh, this is great. So it's really interesting to be like, hey, the things that are happening in Silicon Valley are the same things that are happening in research, and sort of the way that the design process is moving. Which about halfway through the presentation I'm going to be using, there's a phrase in there called lean startup, and it's like one of these fancy buzzwords that gets thrown around and people like hold their flag. It's like innovation and lean startup. Lean startup is fundamentally the principles of the scientific method brought to design. And it's do we know what we are building is actually working? How do we do something small? How do we gather evidence and sort of build on the shoulders of giants, if you will, but our giants just happen to be our end users and what they're telling us. So that is sort of jumping midstream, but now I think I get to start at the beginning. Now, is this thing still going to work? Woohoo! This is my first slide. So I was making my slides. It was very, very late last night. And as I was going through, this is my third slide. Can you tell what the difference is between the second and the third slide? Yeah. I couldn't figure out why the page number was showing up on some, but it wasn't showing up on others. So there's the, there it is. So slide number 6. And it was very annoying, and I just could not figure it out. So what I do, just like anybody else, so this is a screenshot of what I go and I'm like, okay, how do I insert page number, right? Because I have this blank slide without the page number. So I go to the insert field. And you can tell I'm using Keynote, which is why I guess the PowerPoint version didn't work. So I couldn't find how to do that, and I go through all the menu items, and finally I'm like, okay, well there's a help option. So I type in page number, and nothing shows up. So this is brutally annoying. So I do just exactly as anybody else does that's my age. I just go to Google. And I Google it, and the answer pops up right away. I didn't have to click on a link that then told me about the answer. I didn't have to scroll down. It just showed up, and it was amazing. And I think that what's really interesting is like, oh yeah, we do that all the time for health. So I typed in what is Huntington's disease, and it was amazing. It was like right there. I didn't have to click on anything. I didn't have to dive into any website. This is the consumer-facing technology that we're all talking about. And I'll actually get to this in a little bit, but that's sort of my introduction, as odd and perhaps weird as it seems. I was asked to talk a bit about the federal digital strategy and how that applies to health literacy. And I will tell you that the federal digital strategy did not have health literacy in mind when it was being developed. It had sort of the larger world of digital government and the direction that the entire industry and the internet is having on our society. But still, I'm going to talk about this anyway. Brief overview of what this whole thing called the digital strategy is. It's a pretty decent document. It's a little, I'm sort of reorganizing a few principles and bringing it down to a level of plain language. But it breaks out these 4 strategic principles. I'm working my way from the bottom to the top, I think, there. One is simply strengthening and streamlining security and privacy processes. This is a government thing. If we are building things, this one's pretty obvious, and we'll touch on this in a bit, the notion that a government digital product being delivered to the citizens of the United States of America and perhaps worldwide should actually have the citizens in mind when they are building things. Pretty revolutionary concept there. This one is even more revolutionary. I don't even need to go into that. The government should decouple data from presentation. Now this is, I'm going to get a little bit nerdy in my presentation, so bear with me for a bit. This is actually one that I'm going to focus on and use as a framework for the rest of, excuse me, the rest of the talk. And next slide. Okay, so what are the differences between, like, what does this mean, data versus presentation? This is data, right? So it's just like a whole bunch of numbers. Usually it's very structured. There's, we often think of Excel files as sort of like, right, this is data. It's a database. All your researchers know what this looks like. Now, this is what they call a presentation. This is actually a database of all hospitals in America that accept Medicare. And then you start to visualize it. And what you can do, you've got the data, you can visualize it 100 different ways, right? So this is one visualization, this is another visualization. There are like 15 bajillion visualizations you could create based upon the data. But this only works if this is beautiful. So the federal digital strategy actually begins with a very, very important framework, and it lays out 3 different layers of digital service, as they call it. And here again, I'm talking about the presentation layer, the data layer. There's this middle thing that I'm going to call the management layer. It's sort of like, how do people get down into the data, and then how does it get released and pushed up into presentation? Diving into these a bit, it's very important to recognize that each of these is its own world. We could have really, really long conversations about each of them. But addressing each different component allows for the ultimate sort of goal that we're trying to do, which is a better experience, a better service being delivered to our customers, the American people. Note that in that presentation layer, I think I have to come up here to do this, looks like. There's 2 things, right? So government can do things, but also the private sector can do things. Lots of ways for things to get to the customers. So as we talk about these, I'm going to dive. The goal of this is again that spreadsheet. We want the data to be beautiful. We want it to be very useful, because when it's useful, and these are ways that you can make data useful. Very important. Data is often seen as just numbers. Words can be data as well, as long as it is structured. So it could be sentences, it can be text messages, for example, that end up getting turned into something called healthy mothers, healthy babies, which has already been referenced in this conversation today. As long as it's sort of organized in a structured format, words can be really, really useful as data. This middle layer, the goal here is to allow for easy access to the data. There's some obvious concerns about privacy and security. So this is sort of where those controls get put in place. I don't know if anybody knows about APIs. There's various like formats the data can be released as well. And then the goal here, this is the presentation layer. This is where like the really interesting space is. This is where the interaction with the customer tends to take place. So we're looking at customer service. And providing a great user experience is important because the ultimate goal is actually influence behavior. Providing customer service, providing us a really useful and beautiful website is actually pretty pointless if 1, nobody's going to the website, and 2, you're not actually having an impact on their lives, right? So that's what we're all really trying to do. I think I had an arrow. Yep, that's what I just said. So I work for the federal government. I can tell you we have a whole lot of websites. Most of them are pretty ugly. Now, there's a lot of private sector websites that are also ugly, right? But I think broadly, it's a pretty safe statement to say that the private sector is better at providing interesting You know, I just noticed that my slides are down here, and I can actually look at this instead of doing that. That actually designing great experiences is something that the private sector usually does better. And there's lots of market reasons for that. They've sort of got the incentives, sort of the business principles are driving lots of things. Therefore, what the government wants to do is actually focus on these other two layers. Here's a couple examples of how we are focusing on these. If you are not familiar with healthdata.gov, you should know about it. There's a whole lot of stuff on there. I'll just sort of leave it at that. This is a collection of basically all, the goal is everything that is data related to health is going to be on here. It is growing very quickly. The notion is that it's a one-stop shop, not for customers, right? Because we're looking at these bottom two layers, but for perhaps people that are wanting to use the data so that they can then reach their customers. Another quick example. So this is something called content syndication, and this is the notion where like you can create once and then other people can take it and then they can publish it on their own websites. So this is an example of how the CDC happens to do this. Yeah, sure, we've got the cdc.gov, but they were able to publish the actual words in this case in a way that allows for others here, both private sector, local government agencies, to pick up that content and present it on their websites so that the information is out there and actually it can be tweaked and presented perhaps in a little bit more useful way, sort of, again, adjusting that presentation layer to best meet their needs. This is the blue button. If you're not familiar with the blue button, Google it, because that's what you're supposed to do these days, I guess, when you don't know about things. This is both a larger movement and a set of standards that are being developed. I'm not a super expert in Blue Button, but it is a very important concept to be aware. And the principles behind Blue Button are very important. And it's the notion that every single person in America should be able to download their data and actually be able to use it, right? So their data is their data is their data. And you should be able to go up on any website and hit a button. Maybe it's blue, I guess it could be green. And they should be able to actually access their patient data. Okay, so now I'm looking at these three layers again. Well, the government is focusing on the bottom two. We want to be able to support in meaningful ways the private sector in being able to do their job. This actually involves a couple things. Guidance, rules, publishing research. Incentives is actually a really interesting piece, right? Because if the market structure really isn't in place, then the private sector isn't going to spur on betterment and actually provide better services. So we actually try to change the set of incentives, and we run things called challenges, prizes. There's this really significant legislation passed a couple years ago now. It's called the America Competes Act, and it allows for the federal government, it grants sort of larger authorities for them to run challenges with the American people. And we would say, it's a very simple concept. Hey, do this thing and we'll give you money. Or do this thing, we'll give you some sort of reward. And often for us, that thing is create a better user experience. We'll provide the data. We'll provide that management layer where you can access that data in a safe, secure, but hopefully still simple fashion. But we want you to go out and provide that experience to the users. And what happens is that instead of just like a government website being created and you just have one user experience, you have a whole bunch of user experiences, because you could have 50 companies that are suddenly trying to make the best one. So this actually was taking that blue button data. So you can download the data. Downloading it is useful, but again, sometimes it's hard to read. It's very complicated. Often it's very boring. So this was a particular challenge that said, let's make a beautiful patient record. We provided a framework, and actually, oh man, I thought I had the winner in there. There was a winner that was announced, and it's like really actually, beyond even just the winner. There's a number of really beautiful health records that are actually being put in there. This is around the world of standards and guidance. We publish lots of things to help provide a framework within which we hope the private sector will operate. And then often, of course, when the private sector isn't doing things, we'll actually jump in and do it. We take best practices from the startup world, take best things from literature. There are various buzzwords that are associated with what we do. I won't dive into them in particular, but the important thing is that the process is the product. So the iterative design methodologies where you're interacting with your customers, where you're interacting with the patient, hopefully through like very small scale iterations where you're growing this thing, sort of co-designing it with the person that you're serving. That process is what you got to be focusing on. And the outcome of that is hopefully, in fact, if you do it right by the scientific method, will be a beautiful and useful product that serves the American people, serves the customers, and actually drives behavior. Now, we do this on our own for various websites. We try to eat our own dog food. We try to live up to our own standards. Responsive design is sort of one way to do that. So instead of like having a website and a tablet app and an iPhone app, there are actually ways you can build things, so they just sort of line up and can be presented elsewhere. A quick nod to what I'll call data-driven future, and again, data can also mean content, but it's sort of looking at the world through these three layers. We obviously want every single patient, every single American to securely access and analyze their own health data. That's really hard. Right, nobody's going, or very few people at least, I don't even do it, going to download their entire patient record, sort of create macros in Excel and be able to analyze things. Very, very difficult. Instead, what ends up happening is we've got this coming up. Now, this is mostly here. We could talk about the digital divide. That's a very, very important and interesting conversation. But some screenshots from, I think this was at like, a little past midnight last night. So instead of actually going to Google, what you can do, you could just ask Siri, right? And what's interesting here is the particular resource that ended up showing up, Wikipedia. So like, how does Wikipedia, why did Siri decide Wikipedia is going to be the thing? But this is what people are going to be seeing. You could keep going. You could ask sort of how many calories have I burned. This is interesting because Siri Apple tracks how many calories I burned. I got one of those sort of tracker things, but we're not quite there yet, but this is a question that very soon technology should be able to answer. And then it starts to get really interesting, right? So am I overweight? Well, okay, I guess it's hard for her to know that, but theoretically, if I stand on a scale and it weighs me, and there's lots of data that it could have where it should be able to answer that question for me. So, okay, let me ask you a different question. What is my BMI? Maybe it's like it's a really nerdy Siri. I didn't know it. It turns out BMI is a stock, and that's what Siri thought I was talking about. So I was like, okay, well, let me just spell it out. What is my body mass index? And unfortunately, all it does is bring up Wikipedia again. So the world is really, really interesting, and what's frustrating for me is that I actually wanted to know that. So how can we get to that place where that one customer-facing technology is that personal digital assistant? And that's where we're going, and we're actually very, very close to getting there. The only way for us to ensure that the right data and the right information is there is if we look again at this very bottom layer and ensuring that the way we structure the data is overly important to ensure that these massive algorithms and engines out there can suck it up in the right way so that it is presented to the user when you ask Siri the right question. That's what I got. Thank you so much.